Great. Thanks, Katie. And just checking that you can see my slides correctly. Awesome. Well, as Katie said, my name is Chrissy Esposito. I'm a policy analyst at the Colorado Health Institute. And today I'm going to be talking to you about two very important topics, aging and the housing crisis. And before I dive in, I just want to spend literally a few seconds telling you about the Colorado Health Institute, who we are and what we do. So we're an independent, nonpartisan health policy research organization, meaning we don't lobby, we don't advocate or take sides on any policy and legislation that comes through Colorado, but instead we do research and analysis to help support policies and decisions at the community level and statewide. But let's dive into the data and start with some good news. And the great news is that we are living longer in the US and in Colorado. Even due to the year we lost from COVID, we're living about 17 years longer than we were in 1921. So go us. But let's look more in depth. So Colorado is the third fastest aging state in the country. And by 2030, we'll have 1.2 million people ages 65 and older in our state, which is a 50% increase than where we are today. So when it comes to older adults, housing takes on an additional meaning. It's not just a place where you live, it's also a setting of care. So if housing is a setting of care, it's also a foundation for our health. So to put it more simply, housing is health. And even if we did solve the housing crisis for older adults, they still might not be able to age successfully in their home, because we also think about home care workers who are just as rent burdened as older adults they care for. So with all that said, we can see that housing is a very important equation when it comes to aging and caregiving. And I'm going to spend the next few minutes just telling you more about the issues older adults face with affordability and accessibility of housing within our state. Starting with affordability, because it's no secret that housing is very expensive in Colorado. And this can be particularly tough for older adults who likely don't have the same incomes that they had when they were in their prime earning years. And in the past decade, Colorado has become one of the least affordable states for housing. And to put it into perspective, about 500,000 older adults in 2030 will be housing cost burden. That means 1/3 of their income is going towards rent or mortgage payments. And so if they're diverting this money towards rent and mortgage, that means they might be pulling back from other necessities, such as food or medical care costs, things that we need to be thinking about as we build aging infrastructure. And to break it down a little bit more and to kind of highlight this financial pinch that older adults are in, let's look at the numbers. So in the past decade, an older adult's income has increased by about 10%. But as you can see, rent costs and home values have increased by 30 and 50%. So we're seeing a gap. Now, if we look at it from an average older adult perspective, their median monthly income is probably $2,100. That means affordable rent should be about $650. Many of you are probably laughing because median rent is actually about $1,000. So it's about $350 a month. They're in the red. Now, not all older adults are facing these housing issues because some populations are more impacted than others, just as renters. Renters are about half as likely to be housing cost burden compared to homeowners. And for older adults of color, they're also more likely to be impacted due to historic and racist housing policies such as redlining, which you can see up on your screen, because they were less likely to own homes in the mid-20th century. So older adults of color are more likely to be renters today. So I'm going to switch gears now and talk about another housing challenge. So in addition to affordability, we have accessibility issues within the home and within the community. And why is accessibility so important? I'll break it down for you. So today, about 1 in 3 older adults will develop a disability and need care. But into the future, about 2 in 3 older adults will develop a disability and need care. So it's really important to have safe and functional homes as we age. But let's bring it back to reality, because in reality, about 1 in 3 homes have a 0-step entry in our state, and less than 1% are wheelchair accessible. And we're seeing this trend also continue within the community. So over time, fewer older adults are reporting that they have ease getting around to places in their community. And this is to medical appointments, social events, pharmacies, grocery stores, all really important things. And this also can be exacerbated in rural areas. And just to highlight an example of why accessibility is so important, if you have a walkable neighborhood, that means you have a better overall health. There's lower rates of cognitive decline and lower rates of obesity. So accessibility is health. And my question for you that I'd like for you to just noodle about today is, as our state is continuing to age and we're seeing these home prices go up and up and up, I'd like for you to think, are we creating an environment where more older adults will be housing insecure into the future? Thank you.